The deadly MERS virus that killed 145 people worldwide continues to worry health officials.
And now the CDC has an urgent warning for travelers. Here's CBS 2's Dr. Max Gomez.
Doctors say a 44-year-old patient with MERS exposed two healthcare workers at this Orlando hospital. Both had flu-like symptoms and one has been hospitalized. But tests for the MERS virus in those workers today came back negative. Another 20 healthcare workers who may have been exposed to the Middle East respiratory syndrome were sent home as a precaution.
It has a very high mortality rate. About a third of the people who have acquired this infection have died of it.
The virus causes coughing, fever, and sometimes worsens to pneumonia, which can be deadly. More than 500 people in the Middle East have been infected this year. The majority of cases are in Saudi Arabia. The infected person is a healthcare worker in Saudi Arabia and came to Orlando on May 1st. There's concern that he could have infected fellow travelers during his multiple flights. The CDC has started posting these warnings at major airports, explaining the risk to travelers.
The CDC is taking the current situation very seriously and is working in close coordination with local health authorities.
The World Health Organization is keeping an eye on MERS and says it's not yet a global health emergency. Researchers have determined that the virus is genetically similar to the SARS virus, and both may have come from bats. In the case of MERS, scientists suspect the disease is linked to camels. WHO recommends that people avoid contact with the animals, including camel milk, meat, and other camel fluids used in medicine. Health officials stress that so far MERS does not appear to be easily transmissible. It seems to require close, extended contact with an infected person or perhaps animal, and at this point, the two U.S. cases have not resulted in any other MERS infections. Dr. Max Gomez, CBS 2 News.